In week 6, we examine again some of the problems of dealing with the vascular patient from a surgical perspective. And Neil Mercer speaks to me here about the task of anaesthetising a patient who is about to go for vascular surgery. Now, this strikes me, as a non-anaesthetist, as a terrifying prospect, but the thing I want you to note about Neil's presentation is the sheer confidence with which he takes his job on. I mean, you know, he's aware of the risks, but he clearly feels that, having taken the risks into consideration, the prospect of anaesthetising a patient is pretty safe. In addition to this, we have the words of a vascular specialist nurse, Paula. The significant thing about all of the vascular specialist nurses that I've met while I've been compiling these works is just how knowledgeable, just how deep the knowledge is, and not just the knowledge, the book learning knowledge, the sort of deep knowledge and practice of dealing with patients who are suffering from all of these conditions. And Paula was a good example of that. You know, I can imagine that if I developed vascular disease, I would be more than happy to have Paula as my nurse. Lastly, we examine this week the phenomenon of phantom limb pain. This is a extraordinarily disturbing situation for a person to find themselves in. I'm sure you'd agree, especially in situations where they may have had an amputation for pain, and then the person wakes up and over the weeks and months that follows, the same pain, almost identical, re-emerges. And the treatments which are on offer, particularly the new treatments, the psychologically based treatments such as using mirrors, raise all sorts of philosophical questions about the nature of perception and how we know the reality around us. I found this one a particularly interesting lesson to develop, because this is such a... the philosophers argue about phantom limb pain. It's a very commonly discussed phenomenon among philosophers, and yet for nurses who work in this speciality, the concept of phantom limb pain is day-to-day bread and butter practice. So, hope you enjoy it.